Leanne, what's been your overall experience with using the CALCiViS imaging system?
I found introducing the CALCiViS system to our practice to be a huge asset. In my experience, I find that patients are very visual creatures, and so having something to show them that helps to strengthen the message I'm trying to tell them has been hugely beneficial.
It's amazing, good. And I know that in the beginning you had some reservations of purchasing this system, didn't you? But what really made you purchase the system?
Well, as a practice, we've always been very prevention focused, and so the temptation to have a tool that would allow me to drive that forward within the practice was great. And I was fascinated by CALCiViS, by its concept and by its technology, but I struggled initially to see how I'd implement it into my daily workflow. I was very lucky though, because last year CALCiViS invited me to be part of a small clinical trial, and that allowed me to see firsthand the benefits it would give both myself and my patients. And to be honest, it was the patient's reaction to the technology that really made me decide to invest in the system.
Okay, so since then, since the trial, obviously you've purchased the system, how have you then integrated it? Because you were a bit unsure about that, so how have you actually integrated the system?
I decided to take a bit more of a gentle approach in integrating it into the practice. Last year I was converting my patient list from NHS to private plan, and so I used it as part of the business strategy to aid in that conversion. I wanted to give extra value to our private examination, something different and unique that I hadn't done for these patients on the NHS previously. And so we built in the fee for the CALCiViS screening into our plan so that our patients would benefit from a screening annually. And we also increased our private new patient assessment fee so that it would incorporate some CALCiViS screening as well.
Okay, so as a business strategy then, you were already moving towards private, and you've almost used this as a way to increase value in your exam fees.
Absolutely,
then,
yeah,
okay.
Absolutely.
And then you mentioned there about the new patients, so have you increased the fee of your new patient exam?
Yes, we have.
Yeah,
so
okay.
it includes a CALCiViS image in their first appointment when you come to the practice.
So it's almost like a selling point or a building value in your new patient exam as well, isn't it? And so when you're actually using the imaging system on your patients and you're capturing the images, how is that influencing your clinical decision?
I find that having the CALCiViS images alongside the information from my clinical examination, putting them together really increases the confidence in the decisions that I'm making. As I started to use the system, what I found was that in these more subjective lesions, there were times where the information that I gained from the images would actually cause me to alter my proposed treatment plan. And it alerted me to the fact that without the CALCiViS images, there was ambiguity and definitely scope for error. And unfortunately, we are facing ever-increasing litigation as dentists, and anything that helps to strengthen our records and to really justify the decisions that we've made, whether that be treating a patient or not, can only be positive in my mind.
Yeah, I think that's a really, really good point to make actually, certainly in today's world in dentistry. And when you're taking these images then, are you sharing them with your patients?
Oh, absolutely.
Okay.
I mean, one of the biggest benefits of CALCiViS is the improved communication that you have with your patients. You show them these images and they're new and they're exciting, and the patients are interested, and they're interested in what these images represent, and that allows me very naturally to lead into talking about prevention with them. And what I'm finding is that it helps me to get across the message that I've been trying to do for the last decade, but with more success.
So it's helping you to actually get the message out that you've been doing for
they seem to understand it better once they see something.
Well, that's really good. That's amazing actually. And when you've engaged with your patients, taking these images, what sort of reactions have you had from them?
It's been really positive reactions. I feel it really helps with the trust. You know, you're showing your patient these images, and they can see them and they can understand them, and then you're often saying as a result of these images that you're not going to do anything. You know, you're not going to treat them, you're not going to drill their tooth. And that's a really powerful message, because the patients start to believe that you are very much focused on preventing oral disease. And I also find when they see the bioluminescence, they become actively engaged, and it really encourages them to take ownership of what's happening in their own mouth. For me, I like to see the progressive images. So I've always applied fluoride to suspect lesions. And we're taught that it's a very effective remineralising technique, but assessing the success of that is as subjective as assessing which lesions need it in the first place. And so it's very comforting for me to be able to put two pictures side by side that have been taken a few months apart and confidently say whether that lesion has now remineralised or whether it's still actively progressing. And I think that's very important information for me to have as a clinician. It's also important information to share with your patient again, because it shows them if the changes that they've made at home are enough and have been successful.
And I guess it's a bit like, I think that's really, really good. I think it's a bit, when I think of a perio chart, for example, so you take your perio chart, you note down your bleeding, you do your periotherapy, you get the patient back, you do your second chart, and you have comparison. But with caries, until now, we don't have that.
Compare. Patients like a challenge as well, so quite often if you can try and challenge them and show them if they've been successful, it can really help with to change their attitude around with regards to it.
It's involving them, isn't it? It's like it's really, really involving them so that they're actually, you want your patient sent to be almost hungry to be, what do I need to do to remineralise that tooth? To prove and to get we all like getting told we've done something well, don't we? So that's an amazing experience that you've had there with the patients. Leanne, you've really shared some great insights into your experience and the benefits of for you as a clinician and that the patients have experienced. How would you say that it's affected your business?
Now that I've been using the system myself for over 6 months, I feel more confident to roll it out to the rest of the practice. And my plan is to do this through our hygiene therapy service so that all of our patients, both NHS and private, can start to benefit from the system. My mission is to produce a really comprehensive and strong preventative programme within the practice. And I think this should be led by our hygiene therapists. They play a key role in patient education and prevention. And CALCiViS gives them a platform whereby they get to use exciting new technology, but also build these relationships with the patients. I want my patients to start to value prevention more as well and value their time that they get with our hygienists and to see preventative hygiene appointments as far more than just a clean. And my hope is that to bring in our caries prevention programme, it's going to increase the hygienist's role and their worth and how they're perceived by my patients.
That's amazing. That just makes me happy as a hygienist. I think you've really hit the nail on the head when it's about more than a clean. Because so often practices have got the best intention with their preventive programmes that they're delivering, but sometimes all it is a clean, and actually even the receptionists and even some clinicians call it a clean, so it really devalues it. And I think by bringing CALCiViS in and a caries prevention programme and adding it into a perio-preventive programme, it's really more comprehensive, isn't it?
Absolutely, and it will make it easier to adjust your prices to allow for the CALCiViS screening. The patient wants to know they're getting value for money and what they're getting for that.
Absolutely, and I think your levels of communication and what you're delivering out builds value, and as long as you can explain exactly what you're doing and the benefits to that patient, they normally are happy to pay for it. And you've experienced that already. And then when it's on, I think you've done it really well actually, because as a dentist, as a clinician, you really want to get your hands on it. You want to understand and interpret the message and really get in synchronisation with it and what you can in comparison to looking at the teeth. I think rolling it out to the hygienist as your intention and plan is definitely the way forward as we've described. So I think you've done it the right way though. I think you've done it really, really well. And when you think of your whole practice then, because your list is private, but you've got associates list that's NHS, and so is using the hygienist, then it's going to create a way of...
It'll create a pathway
bringing
to
those,
allow access for NHS patients to the CALCiViS system.
That's excellent. Leanne, can I finish off by asking what advice you would give to any dentists or hygienist therapists out there that are perhaps considering the system, the CALCiViS imaging system for their practice?
I think if you're serious about prevention, then CALCiViS is definitely a tool that you want to have within your practice. It will enhance your communication with the patients, and patients value it and will start to trust you. And it's a powerful ethical message about how you are as a dentist and that you're really focused on disease prevention. And ultimately, it can allow prevention to be profitable as well.